Once again, thank you for joining today's webinar. My name is John Juliana, and on behalf of SmartSheet10 as well as TriZetto Provider Solution, I'm very pleased to deliver this brief yet important webinar to you today. First, I'd like to start by just telling you a little bit about myself. As you might have gathered from my name on the screen here, I'm a podiatrist by trade. However, I also serve as a healthcare consultant. I've been consulting with providers of all different specialties for well over the past decade or so. So today I'm going to actually speak to you about ICD-10, not only from the eyes of an actual provider, but also through the eyes of a healthcare consultant. Now, a little bit about some housekeeping before we move forward. This webinar is going to be recorded, so we'll make sure that you have ability to retrieve it at any time and listen to it again at your leisure. That'll likely be through the TriZetto website, but there'll also be an email at the end of this webinar that anyone can reach out to us to obtain a recorded version of today's webinar, as well as to ask any questions. Because of the number of attendees, it's not normal that I can actually answer questions live, but please feel free to type in your questions into the GoToWebinar box, where we'll be able to retrieve those questions, and at some point in time in the very near future, we'll get you those answers. Or again, just feel free to contact us at the website that you'll see at the end of today's webinar. So let's move forward and talk a little bit about ICD-10. And throughout this webinar, you will begin to determine for yourselves whether or not ICD-10 is a friend or will it ultimately wind up to be a foe. Many of you have gone through the transition of ICD-10 rather seamlessly. In fact, I've heard many people related to Y2K, how there was a lot of hype around Y2K, and that went rather seamless, as you all know. But let's talk a little bit about the possible ramifications in the future that ICD-10 can cause to our practices. And again, I'm going to be using a lot of my experience as a healthcare consultant to talk about some of those things that I'm concerned about. Let's first talk historically about ICD-10. As you know, it was delayed for a few years, and then finally did happen this past October 1st. However, at the last minute, Medicare did come up with some different rules that sort of was a little bit of a reprieve for us. They came out with the family flexibility rule, which simply means that between now and October 1st of next year, 2016, we will not get denied for at least selecting the correct family of ICD-10 codes. So that's a little bit of a breather for us. We're not seeing the claim denials that we had worried about as a result of this family flexibility rule. Now, as a healthcare consultant, I do have a lot of concerns about that because I think it's setting us up for some false hopes, and it's setting us up for some behaviors that come October 1st of next year could really cause an adverse effect on our practice. We all know that the behaviors that we develop very early in a task are those behaviors which are the longest lasting and those behaviors which are most difficult to change. So if we're not selecting the most specific code, if we're using a tool that is not allowing us to select the most specific code, you'll be fine between now and October 1st of next year. But what I worry about is what happens come October 1st of next year. And certainly some of you might already be seeing some rejections and denials simply because not all carriers are abiding by this family flexibility rule that Medicare has given us. So we are seeing some, but not as many rejections as we had thought. Again, as a healthcare consultant, I seriously doubt that a year from now, many physicians, many providers are going to be happy that Medicare provided us with this 1-year grace period, because we are then going to be facing a challenge of how do we get to that most specific code. And most important to our discussion today, how do we get there most efficiently? As a healthcare consultant, I am constantly focusing on a practice's efficiency by looking at their business processes and understanding the cost associated with any inefficiencies. So you'll see that that's going to be a focus later on. When we talk about time and being equivalent to money, process experts examine what's known as lead time and cycle time. It's something that I measure when I do go into a practice for various different business processes. Now, we're going to be focusing today on the lead time associated with your ability to get to the most specific ICD-10 code from an ICD-9 code. Lead time is measured by that elapse in time, minutes or hours. We're not going to be focusing on what's more common, which is cycle time, which measures the amount of time per unit within a business process. We're going to be focusing on lead time, and we'll come back to that in just a second. As you know, there are 3 different methods for searching for that perfect code. And what I mean by perfect is that most specific code. There are books, there are things that I call tools, and then there are things that I commonly refer to as solutions. Books are extraordinarily expensive, and you will see a time study that's actually been performed, and you will see how expensive books are. And I don't mean expensive in terms of the cost associated with buying them. I mean the cost associated with the inefficiency of using them. Then we have tools. Tools are a bit better than books because they at least give us an electronic means of searching for that most specific code, so they are a bit more efficient. However, they still disrupt the normal workflow of a typical medical practice, the normal workflow associated with our revenue cycle management process or the billing process. Typically in a medical practice, in most specialties, the revenue cycle process begins with the initiation of a super bill, and that super bill is then passed off to the billers who then begin the revenue cycle. In the world of ICD-10, super bills are nearly impossible except when you find a solution. By solutions, we're talking about those things that enable you to get to the most specific code in a very workflow compliant and efficient manner. And certainly what I'm talking about here is the SmartSheet10 technology that I will demonstrate for you shortly. You all know, and I'm not going to bore you, with the 21 chapters associated with the ICD-10 books. For you to be able to look through these chapters and find the most specific code takes an enormous amount of time. And it's laden with certain caveats that could easily lead to rejected claims. And this is just one example. Some codes, like fracture codes, require this thing that you probably all are aware of by now, known as the unique 7th character. And by that, it means that with a fracture code, you have to identify whether this is an initial visit, a subsequent visit, and whether this fracture is healing normally or delayed and with a non-union or malunion. Not finding that most specific code relevant to that patient could lead to a rejection. And that's what I worry about come October 1st of 2016. And of course, we have other worries like the excludes 1 and exclude 2 codes. If you're not finding them in a most efficient manner, then it's costing you lots of money. So let's talk and let's move away from books. Books we know are simply out of the question in my mind. They are way too expensive. Let's talk about tools. And the best known tool that is out there are the general equivalence mapping programs, these GEM programs, which basically work as crosswalks to get you from ICD-9 to ICD-10. Now, the problem associated with the general equivalent mapping programs, again, particularly come October 1st of next year, is that these often will get you to the correct neighborhood of the ICD-10 code, and they might even get you to the correct street of that neighborhood, but they often fail to get you to the exact address, to the proper house of that ICD-10 code. And that's where, again, we're going to see a significant spike in rejections come October 1st of next year when this family flexibility rule expires. So that takes us to the solutions, such as the SmartSheet10 solution. And before I actually get into that, many of you probably, like myself, hopefully enjoy the television show The Profit. It's on CNBC, and if you enjoy Shark Tank, and if you've never seen The Profit, I think you might even like it better. It's one of my favorite TV programs, and it's hosted by a gentleman by the name of Marcus Lemonis, and he's a venture capitalist who basically goes into floundering businesses and does a consulting project for them to turn the business around. And of course, he gets an equity piece of the business once he does that. Well, when Marcus Lemonis goes into a practice, he focuses on three things: people, process, and product. It's basically unveiled in every episode: people, process, and product. When we're talking about ICD-10 and our ability to go from ICD-9 to ICD-10, we're not really dealing with a people problem. We're not dealing with a product problem. We are truly dealing with a process problem that is going to cost our practices far more than just the rejections that the claims will create. It's going to create a process problem in time units associated with getting to that most specific code in an efficient manner. And that's where the SmartSheet10 technology is truly a process engineer's dream. And you'll understand as I go through a typical revenue cycle management with you. What you're looking at here is a revenue cycle. And if we start up at about 11 o'clock, we see that the physician typically initiates a revenue cycle by creating a super bill. And what you'll see as part of the SmartSheet10's patent pending technology is that you actually have the ability to create a smart super bill. I'll be demonstrating that for you. And then, of course, the biller can also interact as the first step with a SmartSheet10 technology. But when they do so, and we're moving at about 1 o'clock on this dial now, we absolutely have no wasted resources in searching for those codes. It creates a very efficient process, particularly when a smart super bill is employed. That, of course, and moving down to around 3 o'clock on this dial, increases our first pass claim acceptance to our clearinghouse or to our payer, saving enormous amounts of time in your account receivable report. And that of course, then leads to faster claim payment, which trickles down to less appeals that need to be made, which extend your revenue cycle even further and delays your account receivables even further if you have to make those appeals. And ultimately, up at around 10 a.m. here, we have improved cash flow, and most importantly, coupled with that improved cash flow is less operational costs. That's what I focus on as a practice management consultant. There's actually been some time studies that have been done comparing the SmartSheet10 technology first to the ICD-10 books. And the way this study was performed was by selecting 10 random ICD-9 codes, just 10 random codes, and placing it in the hands of experienced billers and physicians and asking them to compute the amount of time it took to get to the most specific code. And you can see that an aggregate time for all 10 ICD-9 codes, 48 minutes it took to go through all of these 10 codes using a book, compared to 77 seconds using the SmartSheet10 technology. Now that's a differential of 46.7 minutes between the book and SmartSheet10 technology. Now that 47.6 minute differential becomes even greater as the number of patient encounters throughout the day increase. We've only selected 10 random ICD-9 codes. So based on these studies, what was found was that the lead time associated with coding by books versus the SmartSheet10 technology saved up to 2 hours per day, and up to 1 hour per day compared to a typical GEM program. When we compared SmartSheet10 to a GEM mapping program, it saved up to 1 hour per day. Now you might be wondering, well, what does 1 hour per day actually cost my practice? And you might equate it simply to, well, it's the salary or the dollar amount per hour that I'm paying my biller. And I will tell you that that is a common fallacy, because what we're not including in that cost is this concept of opportunity cost. Opportunity cost is a microeconomic term that basically defines the cost of something foregone because you chose to do one thing, you could not do another. So in reality, that 1 hour costs the hourly rate of your biller plus what that biller could have been doing to increase revenues in some other area of your practice. That's true total cost. And when you begin to multiply that by 5 days per week and 365 days per year, that cost begins to become monumental. And that's where efficiency and the concepts of efficiency really have to be taken seriously. As I go through the demo of the SmartSheet10 technology, I'd like you to focus on just a few things. Number one, it is absolutely simple to learn and use. It's electronic health record agnostic, meaning that doesn't matter what type of EHR you use, it could be used standalone or it could actually be integrated into that electronic health record, creating even greater efficiencies so that when the code is selected, it could actually auto-populate the invoice of your practice management system. You'll also note that it is color-coded. You simply can't make a mistake because what you're searching for are green codes, which are the CMS-approved codes at the most specific level. And it gets you to those most specific codes in just seconds, not minutes. It also dual codes for you. Now, those of you who understand dual coding, it allows you to select both the ICD-9 and ICD-10 code so that rules can be written. If this is integrated into your electronic health record, rules can be written so that your system understands whether to populate the 9 code or the 10 code, depending upon the insurance carrier, because not all carriers have moved to ICD-10, for example, workers' comp. And for at least now, you might still be sending some claims ICD-9 because the date of service preceded October 1st. So the technology dual codes to help you mitigate that. And then lastly, you'll see how it is very, very workflow compliant. It allows that super bill to be used as the initiating point of the revenue cycle. Okay, let's take a look At the SmartSheet 10 Technology, I'm going to show you a series of screenshots. And first, what I'm going to do is utilize a familiar arena to me. As I mentioned, I'm actually a podiatrist by trade, aside from a healthcare consultant. So at first, I'm going to use some podiatry codes, but then I'm going to show you how it's not only EHR agnostic, it is specialty agnostic as well. Doesn't matter. I'll show you other codes and how it works no matter what specialty you are. Up in the left-hand side of the screen here, I'm typing in my ICD-9 code for what I know to be a bunion, hallux valgus, 735.0. What happens immediately on the right-hand side of the screen is that it takes me to the exact chapter of the ICD-10 book where hallux valgus is noted, where this black arrow is, M20.1. But notice how that is black. I have to click it again to open up until I find the green codes. The green codes are the CMS approved ICD-10 most specific codes. Now you'll notice here that actually hallux valgus unspecified is a CMS approved code, but I know better than that. I know that I have to pick laterality. So once I select my laterality of the right foot, everything on top turns green, and it gives me the M20.11 hallux valgus right foot. It's that simple. But that's not all. That was simple, and that surely doesn't demonstrate all of the attributes of the SmartSheet 10 technology. Let's take another example. Let's suppose I knew my ICD-9 code for an ankle sprain, 845.0, and I typed it in. On the right-hand side of the screen, once again, notice how it took me to the exact chapter of the book where ICD-10 resides for ankle sprain. But again, it opened me up to a black chapter. I have to simply click it until I find the green codes. And this time, when I go to select my laterality of right ankle, I'm given a pop-up alert to tell me that a unique appropriate seventh character is necessary for this code. And I simply then have to select whether this is an initial encounter, a subsequent encounter, or a sequela. In other words, is the ankle sprain associated with some other disorder? And once I select that seventh character, you will see on top everything turns green and all 7 characters are ready to be billed, whether standalone or if this is integrated into my electronic health record, it will auto-populate my practice management software. Here you see that the search doesn't only work by numbers, it works by words as well. If I had a fractured metatarsal, all I would need to do is type in FRAC, and immediately on the right-hand side of the screen, it's going to take me to the chapter where metatarsal fracture is located. I click on it again, and it takes me to my green codes. And once again, when I click on the laterality, I am told that I need to select a 7th character on this code as well. And I have to document, particularly if it's a subsequent encounter, whether this is healing in a routine fashion, delayed fashion, malunion, non-union. And only when I do I get the most specific ICD-10 code, all color-coded for me and with simple click of a button. And that's still not all, because what I talked about before was the efficiency concept of lead time and how the SmartSheet 10 technology allows for the natural behaviors of the historic manner in which our revenue cycle is created. And that takes us to the patent pending portion of SmartSheet, which is the Smart Super Bill. What I'm showing you here has been created in literally less than 10 seconds. It's a Smart Super Bill located on the right-hand side of my screen. I've only chosen 6 of my most frequently used ICD-9 codes. I could have chosen 20, 30, it doesn't matter. I've only chosen 6 for the purpose of this demonstration. So this becomes my super bill, and this is provider specific. Each provider within my practice could indeed have their own unique super bill. Suppose I had a patient with dermatophytosis of the foot. It's nothing more than athlete's foot. Notice how it's green across the entire area. That tells me there's a one-to-one match. And by clicking on it, it automatically is going to dual code. There's no further investigation that needs to be done because it is a one-to-one match already. But suppose I had a patient with hallux valgus, that bunion again. Notice how when I click on my super bill, it's yellow, it's not green. That tells me that there's not a one-to-one match. And by clicking it again, it takes me right to the SmartSheet10 database again, immediately to the chapter where hallux valgus is located, and I simply have to click my laterality, which becomes a green code, and I'm done. I'm going to pause here for a moment because I also want to highlight the fact that you see inclusion term here. The SmartSheet10 technology is not only an efficiency solution for ICD-10, but it's also a vast resource for you. If I had opened this inclusion term tab, it would tell me exclude 1, exclude 2 codes associated with my ICD-10 hallux valgus code. So it's an entire library or resource system for you as well. And once I click my laterality, you see it does populate both dual codes here of ICD-9 and ICD-10. So let me go outside of podiatry and show you some other super bills that I created, again, literally in 15 seconds by copying my most prevalent ICD-9 codes from my practice management software, putting them right into SmartSheet10. If I were a general surgeon, this might be what my smart super bill looks like on the left-hand side of your screen. If I had a patient with abdominal pain, notice it's yellow. I simply click on it and it takes me to the exact chapter, the R10.1, where pain in upper abdomen is located. But I know that I can't use that simply because it's a black code, and on top it comes out red. But when I click the proper quadrant and I'm searching for that green code, I know I'm at the most specific when I'm documenting right upper quadrant pain, R10.11. It's that simple. If I was a pain management specialist, my smart super bill might look like what you see on the left-hand side of the screen here. And if I had a patient with reflex sympathetic dystrophy and I clicked on it, notice that it's yellow, takes me right to the exact chapter where complex regional pain syndrome is located within the ICD-10 book. I simply click until I find my correct green code. In this case, it's complex regional pain syndrome of the right upper limb. And that's when I know I'm at the most specific code and everything on top turns green. If I were a hematologist, for example, and I had a patient with pernicious anemia, clicking on my super bill takes me to the chapter of iron deficiency anemia, but it's black, and up on top it's red. I have to note the cause of this iron deficiency anemia by clicking and finding intrinsic factor deficiency, and then I'm at the most specific code. And last example, if I was an obstetrician, and I had a patient with placenta previa, I click on my smart super bill on the left-hand side of the screen, takes me to the chapter for placenta previa, but I have to click to find the green code, and I notice that what is mandatory is that I have the correct trimester. And once I click the appropriate trimester, everything turns green. So I hope you enjoyed this webinar, and I hope that it highlighted for you some of the things that I would like everyone to focus on as we transition through this 1-year grace period. We don't want to do so thinking that this was merely just another Y2K. Come October 1st of 2016, that family flexibility rule is going to expire, and I pose the question, how efficient is your technology going to be able to get you to that most specific code without surmounting the enormous costs, including the opportunity costs that we talked about? Please, if you have any questions, feel free to email us at sales@smartsheet10.com. We're always happy to answer those questions. Again, this webinar has been recorded and it will be available to you if you email us, or if you go to the TriZetto website, you'll have the opportunity to listen to it at your convenience. Once again, thank you very much for joining, and I wish you all a great day.